continue my work clinically in hospice medicine. So Evidently is an AI platform really with the intention of creating transparency and clarity from the beginning to the end of a patient's experience in a healthcare system. So starting with unearthing and linking directly to all of the patient's past medical information, including things like scanned PDFs, unstructured data in the health system, which is largely unseen by a lot of EMRs, and then taking that into documentation, creating clinical summaries from that, and then on the back end, using that information, oftentimes a lot of additional diagnostic information in order to inform coding on the back end. So really from the start to the end, trying to make it easier for clinicians to do their jobs, but also for the healthcare system to capture the value of that clinician's work and cognitive energy. And so what's unusual about Evidently is that whereas many AI companies are doing little pieces of this or aspire to do the whole thing, we do it now, and we do it extremely well. One thing that I wish people would ask, especially healthcare providers, when they're thinking about an AI system in their organization, is about how they can be sure that the AI is doing what it says it's doing and how they can stress test it. Because often there's a lot about AI that can feel like a kind of murky space where an answer just explodes like a rabbit out of a hat. What we've done in the way that we've engineered this software is to really create within 1 or 2 clicks, the ability to figure out, are we telling the truth? Is this real? Is this information accurate? And that's what we think that people need, especially frontline clinicians need, in order to really have trust in what we're doing. So, one of the axioms of medicine is first to no harm. We abide by that at Evidently as well. We want to make sure that what we're doing is actually augmenting the physician's ability to do their work, not replacing it, and certainly not making it harder or more challenging. And so I think when I think about what I wish people would ask about when they're considering an AI solution is, do I understand the technology? If it can't be explained in a way that a frontline clinician can understand, obviously there's a lot of kind of minutia that may or may not have exposure to. But when it comes to the basics, can you draw a line between A and B, between the information you're receiving from that AI tool and the information that you're putting in? That should not be unclear. That should be really clear. And so when I think about what physicians and others within a healthcare organization can do to stress test is make sure that you understand that line. I would also say make sure that there's a clinician involved in developing the solution. At Evidently, we have 2 physicians in our senior leadership, and really the tension between engineering and those physicians is what generates and develops the product. I think that tension is essential to safety in AI. Tech moves at the pace of innovation, healthcare moves at the pace of patient safety. And so you need that conversation happening back and forth in order to kind of nudge healthcare forward, but also to make sure that AI is only progressing at the pace that makes sense clinically and in terms of patient safety.